Now moving on for the next 5 to 10 minutes to Emma and Mike Malongo on the Global Health Elective. Over to you, Emma.
Morning, everyone. Really nice to be able to speak with you again. This is a little bit of a repeat for those people who were with us yesterday evening. I haven't seen Mike on the chat, so I wonder whether he's struggling to join us today. So I'll just introduce what we did as part of a team. So October, I think it was, last year, I realised that the medical students that I was teaching at Leicester Medical School were not going to have the opportunity to do their overseas elective because of the ongoing pandemic. And I just thought, well, is there a way of simulating that working with and alongside and learning from people from another culture? Could we do this in some online way? So that was kind of the germ of the idea. And thanks to the management team at Prime, we managed to develop a memorandum of understanding between the Leicester University and Prime that we would deliver an online global health and education elective. The idea was to teach global health topics to both Leicester students and some buddy students from another country. Our initial contacts were unable to help us because they had an outbreak of COVID, which completely put paid to their medical school's ongoing programme. So at very, very short notice, Kizito and the CMF Kenya team stepped into the breach and actually persuaded me to take some extra students. So we ended up with 5 students from Leicester being taught alongside 10 Kenyan students who represented 6 different Kenyan universities to have a 6-week online course in global health. We also recruited tutors through Prime. There was myself, there was Marion Griffiths, who's a retired GP on the South Coast, Jonathan Fisher, who many of you will know, who's got lots of experience in working for NGOs and who lives in Switzerland, and Mike Malongo, who's one of the Kenya team. So that was the 4 tutors working across 3 time zones. So we had 6 weeks to deliver the programme. We had to write the programme and it was all very last minute, but we came up with something that seemed to work. So we just had twice weekly Zoom sessions for 3 hours. We went through a variety of different topics and we paired the students up, 1 Leicester student with 2 Kenyan students, to work together. And that seemed to really work in terms of developing friendships and collaboration internationally. The students' feedback said that they loved those breakout sessions, that they wanted them to be longer, and some of them are still in touch with their buddies even now. So after a bit of discussion with the students and with the teaching team, we came up with kind of 3 main strands to the teaching. The first was global health topics, so things like universal healthcare coverage, maternal and child health, equity, and all sorts of things that, you know, looking at medicine on a global scale. We also had a theme that was kind of the stuff that Prime is really good at. So we looked at some interactive teaching techniques, because the ability to teach is really a key skill for anyone who wants to be involved in global health, passing the message on, whether that's a public health message to a community in rural North India, or whether it is training junior doctors you know, in South Sudan or something. Teaching skills was really key. And we also included the whole person medicine concept in there. So that was global health topics plus kind of Prime topics were included. And then as a response to the students, so the Leicester students particularly wanted to know how could they be involved in global health as part of their NHS career. So for each session, we invited different speakers who had done different things globally to share just for 10 minutes with their experience, and then to answer questions from the students. So we had an A&E doctor who has done work with Médecins Sans Frontières, gave a very honest presentation about the joys and also the challenges of working with them. Some colleagues from Leicester shared about research that they'd done in sub-Saharan Africa. We had Henry, who's a prime tutor, sharing a really good interactive presentation on the work that he'd done with refugees. And you could just see that the students were really keen to hear these personal stories, and they got a lot out of it. So those were the three themes. The student feedback was overwhelmingly positive, and Leicester University is really, really keen for us to do this again. They want us to change the format slightly, and in fact to open it up to more students. So they want us to do what was taught in 6 weeks, they want us to do it in a 3-week period, but to teach it twice. So one of the reasons I've been given 2 opportunities to talk about this morning was because I really, really need some volunteer tutors. I'm aware that a couple of people stuck their hand up last time and we weren't able to include them because just we were working on a really tight time scale and needed to get a team together that was compatible just really quickly. But we've got Mike and I are running a session a bit later on, and we'd love anybody who's even got an inkling of an interest to come and join us and to talk about what that might look like. And I'll put the dates of the course in the chat once I've finished talking. It was really wonderful working with an overseas international team. It had some challenges, and hopefully we've learned from some of the hurdles that we overcame last time. Things should run smoother, and also we've got some of the material ready. Our current project, apart from recruiting for this year, is to write this up for publication as a pilot that went well, and because I think we've sort of proved the concept that you can simulate that kind of international relationship in the online environment if you try hard enough to do so. It wasn't perfect, it's not the same as an overseas elective, but it's going to be challenging the next few years to get every student who wants to go abroad to actually go abroad, because the medical legal things are causing more and more problems for universities. Insurance is an issue for UK students. So the University of Leicester Medical School believe that this is it should be part of the menu for medical students in their final year. Mike, I think, is in the audience. Mike, I don't know whether you just wanted to say a little bit about how you found teaching on that course as a tutor. What would you say to people who are thinking of joining in next time?
Hello, everyone. It's a pleasure being here. I don't know whether I am audible, but I know there's quite some noise on my end, so my audio may have a little bit of challenge. But I mean, the experience was exciting. Learning from the tutors and also learning from the different sets of students, because there were different insights that we would gather from the different contexts. So it was quite an exciting experience, and we look forward to discussing a little bit more later on when I'm at a place where we have better audio, but apologies for that. But thank you very much for the opportunity and the leadership, Emma, during that time. Thank you, and over and back to you.
Thanks, Mike. Technical challenges as ever, but we're getting there. So that's really the essence of it. Very happy to take questions in the panel session about the content and how we delivered the teaching material. So I'll hand back to Martin.
Thank you, thank you, Emma and Mike. Brilliant initiative, brilliant initiative. Now